And this is part number 53 of the healthcare bill. And we're going to go ahead back on page number 51 and probably now page 52. We're still in section it's section letter C. We're under the lowercase I. There's three little i's here. It says exceptions. Nothing in the subparagraph shall apply to coverage of services described in subparagraph B2 by the community health insurance option. Services described in subparagraph B2 shall be covered to the same extent as such services are covered under Title 19 of the Social Security Act. What is Title 19 of the Social Security Act? Well, that involves Medicaid. This is something that's offered to pregnant women and to newborns. Okay. Now, I looked through section 19 and I didn't find a single reference to abortions. If you find that reference, fine. If you don't, fine. But this is the part where we start covering abortions. Okay, so somewhere in here is about funding and how the federal dollars are going to pay for these abortions and what abortions they're actually going to pay for. So somewhere in the Medicaid and CHIP Payment and Access Commission, you're going to find how the federal funds are going to be paid when it comes to these abortions. And you'll find which abortions they're going to pay for and which ones they're not. Okay. Now, we also have to go through Section D. Section D says assured availability of varied coverage through exchanges. Okay, these are the state exchanges I talked about in the previous video. It says, in general, the Secretary shall assure with the respect to qualified health plans offered in any exchange established pursuant to this title. There is at least one such plan that provides coverage of services described in the clauses 1 and 2 of subparagraph B. So what he's going to say in essence is that you're going to have these health insurance plans. One kind of health insurance plan will not cover any abortions whatsoever. So if you want to buy that particular plan, you're fine. The other plan will cover abortions. You are comfortable with that, you don't pay for that particular plan. So, in other words, when you buy a health care plan through the state exchange, one of them's going to cover abortions, the other one's not. Okay? There is at least one such plan that does not provide coverage of services described in subparagraph B1. And I think you get the picture here. So basically what it's saying here is one healthcare plan in the exchange will not cover abortions, the other one will. And there may be more than two. But at least one of them will not cover abortions, another one will cover abortions. Okay. Special rules. So for purposes of clause 1, this goes back to B1, okay, where they're not going to cover abortions. A plan shall be treated as described in clause 1-2 if the plan does not provide coverage of services described by either subparagraph B1 or B2. Okay. If a state has one exchange covering more than one insurance market, the Secretary shall meet the requirement of clause 1 separately with respect to each such market. Wow. That's a lot. So now you're basically finding out which plans are going to cover abortions, which ones aren't. One is, when you go to the state exchange, one plan is going to cover abortions, one plan is not. That's basically what that says. So, anyway, if you can find something in title number 19, which is right over here, this is Title 19 of the Social Security Act, which covers Medicaid. If you can find something about abortions, or how they're going to get paid for, or which abortions are going to be paid for and which ones aren't, go for it. Leave me a comment down here below that lets me know about all that, and we'll continue this coverage from there. I will tell you more in a future video, so stay tuned.